Valley Talk on News Talk 1580 KGAL.
Well, this is going to be a very interesting show. In fact, I've been looking forward to this show for personal reasons. Healthcare reform is what we're going to be talking about. That's what we're going to be talking about for the full hour. We're not going to be taking phone calls, but we are going to be taking emails. My email address is dave@kgal.com. dave@kgal.com if you want to be involved in the conversation. That's also the address that you can send in an application or an entry to be Quiznos Taste on Us to win that prize. It's a $10 gift certificate for Quiznos in Albany. At the end of the show, we're going to draw somebody's name, and that person will get a $10 gift certificate, good for sub sandwiches, chips, or drinks, anything in the store. Quiznos, located next to Novak's Restaurant, located next to the former G.I. Joe Sporting Goods location in Albany. And thanks to Dale and the crew, tasty sandwiches there. Good, healthy sandwiches. I eat there most every noon and endorse it, and like to see you there at noon today when I stop by and pick up my sandwich. So maybe you will if you'll win. Dave@kgal.com, or you can call the station at 926-KGAL or 451-KGAL. In the studio, we have kind of a repeat guests, Michael Huntington, who is a retired oncologist, radiologist, and then also Nadine Griskowiak.
Very good.
Did I get it close?
Perfect. Yeah.
From RN On Call. Thank you for being back on the show. And we had a conversation earlier in the week. Or was it last week?
Last week.
I think it was last week. About healthcare, about RN On Call, and wanted to have a little bit more in-depth conversation about it. Especially, now I'm going to be quoting some costs here. I'm not going to mention the facility that they came from, but their healthcare costs that I personally incurred. So I don't have to worry about HIPAA regulations when I talk about these numbers on these bills that I've got. And the first question I've got, let's just talk about the cost of healthcare, because this just isn't, it's hard for me to understand. And you're, Michael, a radiologist.
Radiation oncologist.
Radiation oncologist. So I get a bill for a CAT scan that's $3,991 for one CAT scan. And then blood tests that a doctor orders, they're $500 for blood tests. How can anybody making, a moderate living afford that kind of health care? We can't.
We cannot. And the first point I would like to make is that every Oregonian deserves health care. And when CTs and other services are priced like that, that means at least a third of us can't get health care. We can't afford it. Those prices are way too high. It is the reason that they're high is those services are how we finance our healthcare system. We depend on enough people being sick enough or worried enough about their health that they come in for evaluations and they get CT scans. So unfortunately, that's how we finance our system. And in other countries, that's not how they do it. And in Japan, a CT and an MRI might cost $100 rather than $3,900.
So it doesn't cost $4,000 for one CT scan, just for running the machine, I wouldn't think.
No.
It's not gold-plated. You don't pour gold into it. I'm being facetious here, but for a healthcare patient, and I'm fairly healthy. So every time it almost makes you to the point where you don't want to go to the doctor. And that's part of the problem with the system today, isn't it?
Right.
It's so expensive. You go to the doctor's office and a doctor's visit can be $100. If you don't have insurance, a hospital or a doctor's office visit can be $100 or $200 for an office call, depending on where you go. Mm-hmm. So what happens? You don't go to the doctor. What happens after that? You get sicker. And then where do you wind up? The emergency room. And Nadine Griskowiak, I'll just call you Nadine, is that okay?
That's perfect.
Now, you worked as a nurse at an emergency room.
Actually, I worked in probably about half the emergency departments around the state of Oregon as an agency nurse for over 16 years.
Have you seen more of this as an increasing trend where people simply can't afford it, and so they resist going to the doctor? They just put it off, and then all of a sudden what should have been a minor procedure, a minor procedure at a doctor's office all of a sudden is a life crisis at an emergency room.
Oh, absolutely. Over and over again. That's one of the reasons I'm here. Seeing people come in with advanced cancer, and they knew it, but they were not going to go to the doctor, just like Mike has stated before. They weren't going to go to the doctor because they couldn't afford it. And a simple procedure or simple surgery may have taken care of the problem early on, but now we have this full-blown stage 4 cancer, and there's not a thing we can do. So this person, I've seen this over and over again. These people have lost their lives because of lack of access to health care.
So here we are in what a lot of people believe is the most progressive nation in the United States. We have state-of-the-art. We invent everything. We make everything. The United States of America. And I'm as patriotic as the next person. I love our veterans, and I'll wave the flag with the best of them. But here we are in the United States, and people are dying because they simply can't afford health care. So is that what drives you to get involved like you have been?
Exactly. Before I go on, I want to make sure if people are listening and want to follow on the web what we're talking about, we're at healthcareforalloregon.org, and for the Mid-Valley area, midvalleyhealthcareadvocates.org. But back to your question, I was a radiation oncologist for 35 years, and between 1996 and 2006, I noticed how many patients were coming in with advanced cancers because they felt they could not afford to see a doctor when they started having symptoms. So they would come in with emergencies, and of course then we would pay much attention and pay lots of money to try to save them. Each time that happened, I felt very badly for the patient, for myself, and for our country. I knew that our country was better than this. Our country is founded on liberty, freedom, self-enterprise. But when you have a system that excludes people like this, because they're ill, because they're losing their homes to healthcare costs, they lose those freedoms. And that really gets to me.
A lot of people, I would hope that everybody that's involved in this knows that the system cannot continue on its current trajectory. Let's say, for example, obviously the CT scan does not cost $4,000 to do, to function, to operate, to push the go button and have it do the CT scan. So I'm paying for people who can't afford to pay it. However, there's going to be a point where nobody's going to be able to go, if you make it $10,000 for a CT scan, well, hopefully it wouldn't get that high, nobody's going to be able to afford it, and the system will fall in on itself. Is that where we're headed?
That's exactly where we're headed. And on the website, you can see some of these figures, but the projected course of just insurance premiums by 2025 will equal total family incomes at the rate that insurance premiums are increasing at this point. And it's partly inefficiencies in administration and private health insurance, about a 30% overhead when you consider the overhead of providers fighting with insurance companies. But it's partly due to the overpricing of our healthcare services, like you mentioned. Both are working to make this unaffordable. Insurance companies will not have customers. Nobody will be able to afford premiums. And nobody will be able to afford the kind of healthcare cost that you're talking about.
And the system will collapse.
Yeah.
Obamacare, we all have heard the debate on radio, talk shows, TV, newspaper, it's everywhere, where you've got the left versus the right, Obamacare versus the anti-Obama activists. And if we could just come together and come to a solution, that would be the best. But let's talk about Obamacare. The critics are saying that this is America and you cannot force me to buy health care insurance. Let's talk about that first of all. What's your comment to them?
Well, the idea of forcing someone to buy a private product that is faulty, I agree, that's not right. And that's probably the major flaw that I can see in the Affordable Care Act, sometimes called Obamacare. But the parts that I think are very good are the obvious ones. Adult children covered up to age 26. The system will emphasize primary care to prevent people from getting into serious trouble. It will help small businesses afford premiums. many good things about it. But we have to remember that this bill was written by Liz Fowler, a former executive of an insurance company, while she was serving on Senator Baucus's Finance Committee in 2009. So she wrote very specific clauses into that bill that protects the insurance company, including forcing us to buy private health insurance.
Obama, as we look at the Affordable Health Care Act, otherwise known as Obamacare, I'll ask both of you this question. Do you think it's a good first step?
I do. The best part about this is that it puts in front of our consciousness that we should cover everybody and allow everybody to have health care. I'm not saying that this bill does it. In fact, when it's fully implemented in 2019, there will still be 25 million people uninsured and probably an equal number underinsured, which is not much better than being uninsured.
So it forces the issue. Nadine, what do you think? Obamacare, Affordable Health Care Act, good first step?
I think it's a good first step and a step in the right direction, and it allows us to have conversations much like we're having today about what is it we want as a nation, where are we going with this, and what are the steps that we need to take to get there. It's a paradigm shift that has needed to happen for a long time, and it's finally shifting, and those shifts actually take a fair amount of time. And really, the only thing that made me jump on the bandwagon of Healthcare for All Oregon is that everyone is covered. This is why a single payer or universal healthcare system is so much better, is that everyone is covered. In the emergency department, we certainly couldn't say, what is your insurance? We're going to turn you away. But that is, but people literally are not getting care. And so we pay for everybody anyway through the emergency system. We just pay exponentially.
What about the critics of a universal healthcare system here? They look to socialized medicine in other countries and point to some problems in those systems and say it doesn't work. People have to wait too long for care. The quality of care isn't there. The quality of care here in the United States is still better. For example, in New Zealand, where I've spent some time, they've developed a private system because one of the problems they have with the socialized system or the public system is that people have to wait too long for a procedure.
Mm-hmm.
And so they've developed both.
Mm-hmm. Waiting times are a function of public will. In Canada, in the mid-1990s, there were waiting lines for orthopedic procedures. And so you have two choices. You can say, hey, I have a private industry that's going to come in and rescue this and decrease waiting times. Or, as a nation, you can say, we aren't providing enough money for those services that everybody needs. So what happens when you go down the private solution? You end up with people who can afford that private cost, and you end up with the people who can't. So you create the same problem all over again. You're not covering everybody. Those people who are not covered end up coming in at emergencies later.
So you do start putting a price on a life, and you start a class system.
Right.
You were shaking your head when I made my comment earlier, Nadine. You want to jump in the conversation?
Well, interestingly enough, I was just up in Canada, and one of my favorite things to do is to poll the public. And so I was in grocery stores and at hotels and at restaurants and whatnot. And so I asked the Canadian citizens what they thought of their healthcare system, and they were overwhelmingly very happy about it and were not willing to give it up. And they said overwhelmingly, we pay more in taxes, but there's no way I would ever give it up. It allows us a standard of living that is so much better, and we don't have to worry about it.
So, okay, Obama's the first step. It forces discussion, in your opinion, on the issue, and we need to come to the table and do this. What about, we haven't talked about this off mic yet, I'm just going to throw it out there, tort reform. Limitations, and Michael, I'll point this question at you. Should we create limitations on court cases, on awards by juries to people that have been wronged by the healthcare system? We're seeing, we've seen some huge, I believe, huge excesses in this, where minor issues are getting $1 million awards, and that is part of what I think is driving up the cost of healthcare.
I'm glad you asked that question about tort reform. I think the very best type of tort reform is to have everybody covered from birth to death. The major reason people will sue is that they are worried about what is this bad result that I got from the service, the healthcare. What is it going to cost me in the future? Am I going to have surgery to repair this injury to my bowel later? If they know that whatever happens in the future, they will get care, then the reason for suing mostly goes away. There are other reasons, bad bedside manner and so forth, but the major reason is, how am I going to pay for these healthcare costs? So what about tort reform? If we put caps on awards, we might affect about 2% or less of healthcare costs. And they've tried that in Texas, and the premiums did go down for providers, but the overall healthcare costs did not. They continued to go up, and one reason may be that doctors and other providers don't change their habits just because there's a cap on premiums. So the main goal would be to reduce overall healthcare costs, and caps on awards don't do that. Punishing people to try to improve their behavior is not a good route, and it's very inefficient. And only a very small percentage of people who are injured by the healthcare system sue or get any kind of reward. So I think it's a bad route to try to improve our healthcare system.
So one of the discussions that I would like to have with you two is, after we come back from the break, you've mentioned that you believe that the Affordable Health Care Act, Obamacare as we're calling it, is a good first step. Let's say we put you in charge of the healthcare system of the United States, and you're sitting here with pad and paper, and you say, okay, here's the next step I think we need to go and why that is. So we'll answer that question here after we take the break. This is Valley Talk on KGAL. I'm Dave Adams. If you want to be involved in the conversation, send me an email, dave@kgal.com. We're checking the emails live during the show. We'll be right back.
Looking for bargains? Home improvement experts? Solar power? Attend the 18th Annual Albany Home and Remodel Show this Friday, Saturday, and Sunday at the Lynn County Fair and Expo Center. First 50 visitors each day receives a free pair of work gloves. Prizes announced every hour. Tickets and vouchers good for all 3 days, and Armed Services ID holders get in free for Freedom Saturday. Ideas for roofing, windows, flooring, kitchen, and bathroom remodel displays. Petco sponsors the Pet Pavilion. Super prices at this year's Fall Tree and Shrub Sale. Don't miss the Albany Home and Remodel Show this Friday, Saturday, and Sunday. Upgrade for your fall.
The Willamette Master Chorus, Director Paul Clemmy, special guests and soloists wrap up the French Connection season with their winter concert. 2 chances to catch this exciting concert: Saturday the 23rd at 7 p.m. or Sunday the 24th at 3 p.m. The concert will feature the rarely heard dramatic oratorio by Hector Berlioz, The Childhood of Christ, with full orchestra and soloists. Go to their website, WillametteMasterChorus.org, for more information or to purchase tickets. The Winter Concert by the Willamette Master Chorus, Saturday the 23rd at 7 p.m. or Sunday the 24th at 3 p.m. Hudson Hall, Willamette University in Salem.
That's someone enjoying a wonderful meal at McDonald's. That's someone enjoying a refreshing Coca-Cola for only $1. And that's the harmonious flavor of McDonald's and any size icy cold Coca-Cola soft drink or sweet tea for just $1. It's hard to describe it any other way. The simple joy of a la carte only. Prices and participation may vary. Limited time offer.
Listen up, team. There's a bunch of hungry football fans outside. Everyone loves you. You're juicy, tender, and crispy. And when they dunk you in spicy buffalo and creamy ranch sauces, you'll turn these fans into Chicken McNuggets fanatics. Are you ready?
Let the pep talk and pass the Mickey D's, man. Yeah, halftime's almost over.
The fans have spoken. Go kick some taste buds.
The colossal 40-piece Chicken McNuggets. Now just $8.99. More tastiness to love only at McDonald's. For a limited time only, prices and participation may vary. McDonald's is a proud sponsor of the National Football League.
If you're in the market for a quality pre-owned vehicle, then I invite you to stop on by Jones 5 Auto Sales on 9th Street in Corvallis, where every vehicle is AutoCheck certified, passed an extensive safety inspection, ranked, upfront priced with every vehicle pre-discounted compared to Kelly Retail. You'll also find a copy of the AutoCheck report and vehicle condition report located inside each vehicle. It's all at Jones 5 Auto Sales on 9th Street in Corvallis or online at jones5autosales.com. You'll love the way I do things.
The Car Show, Saturday afternoons on News Talk 1580, KGAL.
Here we are in Valley Talk. We're talking about the healthcare system. I'd like to have you involved in the conversation. My email address is dave@kgal.com, and it's also the address you can sign up for Quiznos Taste on Us at the end of the show. Here in about 35 minutes, we're going to be pulling out a name, and somebody's going to get a $10 gift certificate from Quiznos in Albany. Good for anything in the store. You can call the station at 451-KGAL or 926-KGAL, or send an email to me at dave@kgal.com. If you want to be involved in the healthcare conversation, what do you think? Send me an email, again, dave@kgal.com. In the studios today, Michael Huntington, a retired radiation oncologist, and then Nadine Griskowiak, thank you, retired RN nurse.
I'm not retired, actively working, have business owner, RN on call in the gluten-free RN.
Okay. First question I have for you guys, you're obviously speaking out to the public about what you think should happen in healthcare. Has this caused you some problems with people working in the healthcare industry? Do they like what you're saying or not?
Yes. People who currently pay their children's college tuitions and prepare for their retirement really are worried about losing their income from this awkward system that we have in this country. So they're not eager to hear about reducing their pay. But I think I should mention that other countries do have satisfied providers. Most of the ones that have universal health care adequately compensate their providers, and their lives are so much better because they don't have to worry about the overhead of paperwork and refusals and all of the bizarre things that we do in this country to try to keep people from getting health care. So I'd say, I think there is some resistance from physicians, from pharmaceutical industry, medical device industry, insurance companies. But when it comes to the public good and making sure everybody gets health care, we have to change the system. As you mentioned, it is imploding.
One of the things that was told to me off microphone was somebody who was critical of the current healthcare system. Says, Dave, what they're doing is the medical device manufacturers, for example, want to sell CT scanners. There's too many of them out there in the United States, and we have to run patients through them to help the hospitals pay for them. And we need to make work for these scanners so we can pay for them. Is that part of the problem?
Yes. And I might have mentioned before that this is the way we've chosen to finance our healthcare system. Instead of realizing that all of us will need that ICU or that bed in the hospital at some point, why not pay for it ahead of time, like we do for the fire department or for education or for police or public utilities? We can't finance our system based on waiting for a disaster to happen and then charging the victim, a lot of money so that we can go back and pay the nurses. That's simply stupid.
Before we went to break, we said, okay, you're in charge of the healthcare system of the United States. You believe that the Affordable Health Care Act, Obamacare as we're now calling it, is a good first step because it forces discussion. It forces us to throw this on the table and say, the ship's going down, we got to fix it before it does. What's the next step?
First of all, I would change the way in which we are financing Obamacare or the Affordable Care Act. As I mentioned, we're still depending on the private health insurance industry, but a good alternative to this would be to extend Medicare to the entire population. I'm not saying the current Medicare necessarily, but an improved Medicare that may not pay for some of the unneeded care that's given, excessive care that's given, but it would provide care for all of us. And maybe at first we would cover people down to age 55 and then eventually 45 and so on.
How would that be funded?
It would be through taxes, just like the Medicare withholding tax now. But that would replace what I consider a very high private tax that we now call private insurance premiums. Other countries do this for half the cost that we do by using a public unified financing system. That's what I would change.
I can hear people screaming out there that as you say this, that the federal government has never proven by their history that they are an efficient spender of our money. So putting them in charge of the healthcare system and making that happen, they say, is ridiculous, because they simply haven't proven by their practice that they wisely spend our money.
I would get back to the main point is, do we all deserve health care or not? And how are we going to get there? And right now we have a system that excludes over a third of us. So yes, the government needs our input for us to choose the right kind of healthcare system. We have an example of that right now with our coordinated care organizations that is involving the public. They are asked to be taking part in how this coordinated care organization will be managed for our Mid-Valley area. We can do the same thing in a similar fashion for how we manage national health care. All health care is local, and all we need the federal government to do is give us standards that we must achieve.
So you believe we should have more local control, more Oregon state control, more... I believe there's also an effort locally to provide healthcare facilities that have managed and locally directed control. Is that correct?
Yes. Part of the coordinated care organization goal is to have what are called primary health care homes, primary medical homes, which will look at all of the needs for a patient. Why didn't they come for the appointment? They didn't have transportation. So this system would look after some of the extra needs to help get people in for their health care. And this is the type of public planning that we are going to do here, and we can do it all over the nation and follow certain standards nationally that we can adopt nationally.
Some people might believe that's getting a little bit more close to socialized society, socialized medicine.
We already have that. I mean, we do have systems that are set up in our healthcare system. Like the VA system is actually a socialized system, and it works very effectively. And I can't say that I would have always said that, but most recently, having seen it work very efficiently and very effectively up in Portland, I'm impressed. And that is a government-run socialized medicine system.
Nadine, is there something you would like to add to the conversation? I've been talking to Michael here about what he believes the next step should be, as Obama's Affordable Health Care Act forced us to have discussion about this. Where do we go from here? What would you add to the conversation?
Well, I would go back first to, have I been, you had asked Mike if he'd been ostracized at all by any of the other healthcare workers. And I would go back to say, I'm an independent practitioner. I work for myself, and so I have a lot of nurses that are healthcare providers that approach me and say, thank you for doing what you do, because we can't actually speak up about this, but we can't actually leave our jobs either, because we have to have health insurance. So we can't leave our jobs, we can't retire, we can't do what we really want to do. We're stuck in full-time positions, because if we go to part-time positions, we actually lose our health care. So there's a lot of people that have lost their freedom to speak up or to actually move about, because they are nurses or healthcare providers.
So they're working now in the healthcare system. They're afraid to speak up because they could lose their job. If they lose their job, they lose their health insurance, and they're like the rest of us without healthcare insurance. And yet, what they're telling you is that we are crying out to see something done because we see an injustice to the patient.
Yeah, absolutely. And to themselves.
So, next step, as far as you mentioned a couple times the VA system, the Medicare system and the VA system as something we should model after.
It's a great model. It gets people in for preventative care. It takes care of the people efficiently and effectively with very minimal waste, and people are overwhelmingly satisfied. Go visit the VA and talk to the people. That's what I would say. If you have any criticism or are afraid of a socialized medicine system, go to the VA.
What are you two doing now? You've got a bag of buttons and T-shirts here and so on and so forth. You're trying to engender support for this idea of healthcare for all. So are you having rallies? You're meeting at the State House steps? What are you doing?
Right.
There's a number of events that we have planned. February 4th, which is actually Monday, by the way. We have at least 500 people that are going to meet at the Capitol steps, all wearing red shirts. all wearing our Healthcare for All buttons, and we have speakers, but it's the opening day of the legislature, and we're hoping to get a number of people rallying for Healthcare for All. That's one event, and we also are showing movies at the Dark Side, Escape Fire, and the Healthcare movie. We're showing those movies as a double feature at the Dark Side on February 29th, March 1st, and 2nd. We do house parties to educate people because there are a lot of skeptical people, and we love that. People with really good questions. So we'll actually come into a home and give a brief presentation, PowerPoint, the whole deal, and then answer questions. And it's been very effective for people that have questions and don't know where to turn to.
Go ahead, Michael.
Just want to remind people to find out more about this. Go to midvalleyhealthcareadvocates.org or healthcareforalloregon.org on the web.
Preventative care and eating healthy, staying healthy, getting more exercise, something we all need to do. It's human nature. Most people like to sit on the couch, eat the chips, and watch the game, and let somebody else on TV run up and down the field. That's killing us.
Absolutely.
What do we need to do? We've talked a couple times about preventative care. Get off your duff and walk around the block, and you'll be surprised at what that'll do to your health. What do we do to blast them off the couch?
I would like to go back to everybody deserves health care, and that's one way that people find out how to improve their health habits. In Japan, patients see their doctors 12 times a year. Here, it's too expensive to do that, but it's in the doctor's office and with the nurses and dietitians and behavioralists that people can find out ways to improve their health, what they should be doing. This country underfunds its public health services. That's another way that other countries teach and motivate people to take care of themselves. That would be a priority under a single payer or a unified healthcare system, public health.
The Oregon health system and some of the things that have been tried here in the state of Oregon, do you want to speak to that? If anything that comes to mind, and that is a good way to start?
The legislation that I mentioned just a bit ago about coordinated care organizations.
Mm-hmm. The healthcare homes or the...
Yes, and
okay.
The integrated primary healthcare homes are part of that, is an excellent way to address all of the needs that patients have and to instruct them, help them, encourage them to change their or improve their health habits.
And how do those work exactly? Can you explain that?
The model that's been adopted has been researched for many years, including a program in southwestern Alaska about bringing the patient in on how a healthcare system should be designed. And that has yielded very good results in involving patients with, as I mentioned, not just the doctor, but the nurses and the behavioralists and psychologists and dentists and all that are necessary, the social workers, to help that person learn better ways to take care of their health.
How does that look like from the patient perspective? Is it a doc in the box where they go in and there's a low fee where they can go in and simply consult with a doctor or a dietitian? What does the patient see in this model that we're talking about, the healthcare home?
Yes, it could be, and most likely would be, the same doctor that they have gone to. And the part that's different is that that doctor in the office would have more services available to help with some of those needs that I mentioned, whether it's learning new behaviors or dental care, whatever it is.
Vision care, mental health care, access, really local access to those services.
Okay, we're talking about healthcare on Valley Talk today. Again, my email address is dave@kgal.com. We're going to take a short break, be back at more of the conversation. Don't forget to sign up for Quiznos Taste on Us, same email address, or you can call the station at 926-KGAL or 451-KGAL. More on Valley Talk in just a moment. After this, from Charles Osgood.
The Osgood File is sponsored in part by Barbasol Shaving Cream. Start your day with Barbasol, America's leader for a close, comfortable shave. Close shave, America. Close shave, Barbasol. This is Charles Osgood. On the road, Steve Hartman's beat, he meets some folks who are pretty neat, like 13-year-old Shelby Grabens. In a moment, you'll meet Shelby. When you want to send roses for Valentine's, you only have one shot to truly wow her. So don't settle for less. Send her roses from the folks at 1-800-Flowers.com. They deliver the best selection of the highest quality roses, all backed by their 100% smile guarantee. And I've seen those smiles firsthand. If you send her their roses for Valentine's, you will too. This week only, 1-800-Flowers.com has an amazing offer for Osgood File listeners. Order a dozen roses and get 6 more roses with a vase for only $29.99. And for just $10 more, you can send her 2 dozen roses and a box of chocolates. Those are the lowest prices of the season, so don't wait. Order now and make her smile for Valentine's. For this great offer, just go to 1-800-Flowers.com, either from your desktop or mobile device. Click on the radio microphone and enter my last name, Osgood, O-S-G-O-O-D. That's 1-800-Flowers.com and enter Osgood. Or call 1-800-Flowers and mention Osgood. It was on a road outside Denver that Steve Hartman met Shelby Grabens and heard her story.
It was sad. It was really sad.
A few years ago, Shelby's mother, Nancy, was diagnosed with multiple sclerosis.
She couldn't walk. She couldn't get up. She couldn't feed herself.
That bad?
Yeah, it was pretty much dead on the couch.
And she ended up in a nursing home. It was tough.
Shelby's dad, John Michael, works in a water treatment plant outside Denver. But the nursing home bills alone were bankrupting the couple. Shelby, of course, was told none of this, but knew all of it.
Because I could see how sad he was, and I decided to help him.
What did she do, Steve?
What Shelby did was basically start farming. At the age of 9, she got a loan from her grandma and bought chickens. Lots of chickens.
I have 135 about.
Never mind, she didn't come from a farming family. Shelby was determined to tackle this.
Come on, girls.
She'd run the numbers and figured there was money in eggs. If you did it right, which she did. Shelby became the youngest farmer in America to win the Animal Welfare Seal of Approval.
I have to make sure chickens get out, they get to eat bugs, they get to be chickens.
Pair that compassion with home delivery, and you've got yourself a winning business model. Her company makes about $15,000 a year.
It made all the difference, her dad told Steve.
I think we've been homeless. She kept the wolf away from the door.
How's her mom doing?
Today, Nancy is a little better, as are the family finances. Shelby can now put all the profits into a college fund, although should the need arise, she says family remains her first priority.
Just to hear about it warms our hearts and minds. That's the sort of folks Steve Hartman finds. The Osgood File, Charles Osgood on the CBS Radio Network.
Banking these days can be pretty impersonal. You've got your big banks, your internet banks, your do-it-yourself banks, and your too big to fail banks. That's why you might be interested in an alternative. Willamette Community Bank. Hello, this is Bill Higbee, residential lender. You deserve better service without sacrificing a thing. So if you're feeling underserved, make the switch to the best banking option out there with branches in Albany and Lebanon.
Willamette Community Bank. Service like no other. We promise. Member FDIC. Equal housing lender.
Start the new year off right in downtown Albany. Clothing, fine jewelry, do-it-yourself craft stores, furniture, toys, gifts, salons, event venues, live theater, movies, and 23 restaurants. More choices than you'd ever find at any local mall. Find it all in historic downtown Albany. Grab a cup of coffee, learn a new craft, do a little shopping, pamper yourself at one of the many salons, and then enjoy a scrumptious meal. Bring your family or meet new friends. Great entertainment, delicious dining, and unique shopping. It's all happening in historic downtown Albany.
A story of rivalry for love. Swan Lake. Odile tricks Prince Siegfried into being unfaithful to the White Swan Odette. Powerful and passionate dancing exposes the sorcery of von Rothbard, the evil mastermind behind the mystery, with museum-quality costumes and the perfection of classical choreography. Swan Lake, February 1st at 7:30 p.m. at the LaSalle Stewart Center OSU campus. Reserve tickets now at 541-682-5000 or visit eugeneballet.org. In person at Gracewood's Music and Sid Stevens Jewelry. Don't miss Swan Lake.
Into the woods and onto the waters. Listen to Northwestern Outdoors, Saturday nights on Smart Talk 1580.
We are talking about healthcare here on Valley Talk today. If you'd like to be part of the conversation, send me an email at dave@kgal.com, and we would like your comments, good, bad, indifferent, or maybe you just have a question that you would like to pose. Michael Huntington, who is a retired oncologist, radiation oncologist, and then Nadine Horton. Nadine, I used to know a Horton. Nadine Horton was a gal that from one of the markets I used to be in. Nadine Greszkowski.
Greszkowiak.
Sorry.
That's okay.
I'll just call you Nadine.
Perfect.
I think she was a city councilor or a mayor at one of the cities I used to cover. Nice lady.
perfect.
One of the things that I talked about during the break was, is there any bad guys in this? Are there people that are falsely trying to keep healthcare costs up? Are we talking pharmaceutical companies? Are we talking equipment manufacturers? Are we talking maybe some physicians? I'm not going to mention any names, so don't send any flaming emails. But are there physicians that say, you know what, I went to medical school and I spent all this money because I want to make good money being a physician. I want to drive my Lexus. I want to play golf. I did this to make money. So, what do you think?
I get back to our original founders, what they wanted for this country. Life, liberty, and the pursuit of happiness. And they meant everybody. So if we allow incentives that just have a few of us make all the money they want or have the freedoms they want, that, as we are seeing, is leaving out a large segment of our population from achieving those things. We're making a system too expensive for a third of us to afford. That keeps us from taking the job we want, sometimes marrying the spouse we want. It takes our houses away from us when medical costs are too high. I would not say that there are bad people. I'd say there are very bad incentives in our healthcare system right now. And that incentive is you make more money by doing more procedures and doing the most expensive ones you can get reimbursement for. And what that's doing is draining our healthcare resources to the point where we're eventually not going to be able to care for anybody.
Nadine, your comments.
Well,
let me preface it. I'm not saying that all doctors are bad, okay? There are doctors out there that God love them and thank you for what they do that are just really, really in it to help people. But I met a few of them that are in it to make a buck.
Right, and it would be nice if we could take that incentive just to make money out of the picture. Because I know a lot of really great practitioners where their motivation is, I truly just want to be a great doc. Show me how I can give me a system where I can just be a great doc to my patients and practice medicine as opposed to paper shuffling or billing insurances and worrying about reimbursement and whatnot. A lot of the docs are great. They just need a system to work within that actually takes out that motivation where money is the only factor. Money is the overwhelming factor in their decision making for patient care.
Defensive medicine. We talked about tort reform a moment ago. Are there a lot of doctors, I would think, they're diagnosing Mrs. Smith here and we're seeing some issues and you know what, I really don't think we need this test, but I better order it anyway just to make sure that I'm covered in case I get sued. That happens a lot?
Absolutely.
It happens, yeah. And I'd get back to why do people sue? And it is that overwhelming worry that they will have a complication from treatment that's going to be very costly in the future. The best tort reform I can think of is to make sure everybody has health care from birth to death.
Got a text message here from a listener. Would services be free for everybody? What do you think?
Whether we have any kind of copay or not, countries vary on that. Some people feel that you must put some kind of disincentive to overuse or abuse the healthcare system.
Bingo.
And yet, if you overdo that, and for many of our people, a copay of $10 is enough that they will not go in for health care.
And even though I work at community outreach, I volunteer there, and there's still a request for a $5 donation. So no one, even though it's essentially a free medical care, there's still some input from our clients. And they're more than willing to pay the $5 for the health care that they get there.
In France, if you have a chronic condition like cancer, diabetes, hypertension, you pay no copays because that country realizes that if they exclude people from getting the care they need, they will not only have unnecessary suffering, but they will cost the nation more because of neglected illness. So they have no copays. But for most of the people without chronic conditions, you go to your doctor, you pay maybe $45 for the visit, and you get a rebate. You send a sheet into the to the government, and it sends part of that $45 back to you. That's the kind of little bit of hurdle that they put in their system for some of their population.
This is Valley Talk. We're talking about healthcare today. We're going to take our final break. We'll be back for the last 10 minutes of the show, continue this discussion. Again, if you would like to be involved, send me an email. We're checking it constantly during the show today. Dave@kgal.com. We'll be right back.
Going out to lunch at a nice restaurant can be expensive, and the big portions put you more in the mood for a nap than a productive afternoon. Mama's Fine Italian to the rescue. The small appetite senior menu is just right. Anyone and everyone is invited to order from the Light Appetites menu for lunch from 11 to 4 p.m. with tasty entrees beginning at only $3.95. Why go hungry or go anywhere else for lunch? Eat healthy, eat light at Mama's. Closed Sunday and Monday, so make the most of Tuesday through Friday and join your friends at Mama's for lunch. Dinner only on Saturday. Mama's features charbroiled steaks every day. Make reservations for dinner or pick up a bottle of fine wine. Seating is limited, so please call for reservations. 541-451-5050. That's 451-5050. Mama's Fine Italian and Wine Shop on West Oak between Main and 2nd in Lebanon, across from the Big Blue Napa Auto Parts building.
I love you, Frank.
Oh, I love you too, Samsung.
Wait, did you just call me Samsung?
What? No, of course not, Janet. That is totally silly. We've been together a long time. Come on. Of course I know your name is Panasonic.
I'm going to my sister's.
Sony, what did I do?
Big screen TVs on the brain? Get to Sears or Sears.com/football before the game for huge savings on top TV brands. This is the ultimate football experience. This is Sears.
Don't wait for your tax refund. Get your rack pre-fund at Rent-A-Center. Right now, you're pre-approved to buy any name brand flat screen TV, computer, appliance, or furniture set up to $2,500. Take it home today and pay it off in 90 days, same as cash. Everyone's pre-approved for the rack pre-fund. Rental purchase transaction. See store for details. Pre-approved means no credit check or credit required. Final amount of pre-fund eligibility based on available income. 90 days, same as cash, not valid in Vermont.
It's Truck Month at Mark Thomas Motors in Albany. 0% financing for 36 months on 2012 trucks. Ram is the only pickup manufacturer to achieve 20 mpg Highway Plus across its entire light-duty engine lineup. You'll love the Ram 1500 Hemi V8 in regular quad and crew cabs with 3 bed sizes. Get behind the wheel of a Ram truck. Hard charging power, easygoing gas mileage, an incredibly smooth ride, extra grip and pulling power. Lots of 2012 trucks to choose from now at Mark Thomas Motors in Albany. You'll be proud.
Mark Thomas Motors, why pay more?
Farming is fun, especially when you have a tractor like the all-new Kubota Grand L40 from Lynn Benton Tractor. Choose from 8 new models, all with Kubota's powerful, fuel-efficient diesel engines, and a choice of 3 productive transmissions, including the all-new innovative HST Plus. See how the Grand L40s can improve your acreage. Check one out at Lynn Benton Tractor's new location on McLean Street in Silverton. As always, along Highway 99E and Tangent, or this week during the Lynn County Spring Home Show.
Yahoo Sports Radio, weekends on 1580 KGAL.
Yahoo!
I talk it. There's 6 minutes left to go on the show. We're talking about healthcare. Just before we came on, we were just mentioning something that we've all heard stories about people that go overseas for medical procedures and get it done at a fraction of the cost, and they believe the quality of care that they receive is as good, if not better, than they receive in the United States. Nadine, you had a response to that.
Well, that's true. I know several nurses that have done that for themselves. They will get on a plane, go to Thailand, have a surgical procedure, be there for 2 weeks, and come home. And not only does it is cheaper than their copay or any of the bills they would have gotten, but they've gotten a vacation in the whole mix. And so their health outcomes have been better.
But what would you say to the people that are afraid of that and say, well, we don't have the FDA covering it, and is it safe? Get right down to it.
I think we have an over-bloated opinion of what our healthcare actually does. If you really want statistics and whatnot, please go to the CDC website or the WHO, which is the World Health Organization, and see where we rank as a nation for our healthcare outcomes.
And where do we rank? I haven't looked at it.
Number 19.
And 37th.
Yeah.
Number 19 in what category?
Number 19 in preventing avoidable death from illness. That's the most defendable one.
Wow.
Now, the 37 one by the World Health Organization has been out for a while, and that's probably accurate too, but the one that's got the best documentation is the one I just mentioned.
Who's number one?
France.
Interesting. What can people do to get involved, do something about this, make their voice known? We've talked about a lot of things today, and of course, if you want to listen to this program again, you can go to our website, KGAL.com, later this afternoon, hear an entire replay of the show. What can people do?
Well, first of all, learn as much as you can about the fact that we are in a healthcare crisis that needs correction, and that you do have the ability to change this for the better. And I want to repeat the website that you should go to, healthcareforalloregon.org and midvalleyhealthcareadvocates.org. I would encourage you to come to the rally on the Capitol steps this coming Monday, starting around 11 o'clock, and join 500 other people who are asking for a unified system of healthcare that provides healthcare for all Oregonians.
Nadine?
Ask for a house party, even if you're very skeptical, or if you have lots of questions or this makes you angry at some level, please have us come in. We're happy to do a presentation, answer questions, and end up getting your support, which is typically what happens when we come in and do a talk. People, I think their fear is based on misinformation. So a lot of what we do is just make sure that people have the facts and they know what they're basing decisions on, and not fear.
One of the things in the Affordable Health Care Act that is required in this next year is that if you don't get health insurance, you have to pay a penalty. It's a small one at first, it ramps up. Is that a good alternative, good incentive? What do you think?
No, I think that's probably part of the bad or unacceptable parts, is that we're forcing people to buy a product that's not very reliable.
Nadine, you agree with that?
Completely.
What should we do in place? I know we've talked about this a lot. We've got about 3 minutes to go in the show. Let's wrap it up. Closing thoughts, Michael.
I would extend an improved Medicare for all people in the United States. The improvements would be that we would not overuse technology or services like we do now, that the public would have the right to negotiate prices with the drug companies, the medical device companies, and with providers in such a way that we would have people willing to be healthcare providers, but without this tremendous burden of paperwork and bureaucracy.
Nadine, closing thoughts.
Well, please do come out to the rally. Call us or contact us with any questions or concerns. We love the enthusiasm of our collective groups across Oregon. We have, 60 organizations that are currently affiliated with Healthcare for All Oregon. So you won't be the only one. And again, Healthcare for All Oregon is about covering everyone here in Oregon.
And thank you for being with us on Valley Talk today as we wrap up the show. Tomorrow, it's From the Sidelines with Radio Ray and Company. They're going to be talking about issues in the sports. Coming up Monday on Valley Talk, ITEX. If you go to KGAL.com, you're going to see a logo on the website for ITEX. It's taking a look at doing business a different way in bartering, trading services and bartering online. And maybe I'm a doctor and I have services that I want to trade for something else, maybe an air compressor. Interesting. So we're going to be talking about that on Monday's Valley Talk. So I'll see you then. And as always, if you have a comment, send me an email at dave@kgal.com. You have a few more seconds left to sign up for Quiznos Taste on Us. Again, dave@kgal.com, or call the station at 926-KGAL or 451-KGAL. Make it a great day.
Around the clock, around the world. Your first choice for information is News Talk 1580, KGAL, Lebanon, Albany, Corvallis.